So I'm going to show you how to move a patient from a hospital bed or a plinth back into the wheelchair, okay? So the first thing you want to do is, now with this, I'd move the wheelchair because I don't want her feet to have to move over top of the wheelchair. So I'm going to move this wheelchair on this side, and I'm going to set the wheelchair up. Once again, take off the leg rests, get them out of the way. Okay, and I'm going to move the armrest. And this one's going to bite me just a little bit. Okay. All right. And you want to make sure that your wheelchair's positioned close, okay? She already has a gait belt on, which we did that earlier, okay? And so I'm gonna move her from a supine to a sideline position. Couple of different ways you can do this. I'm gonna show you the most common way and the easiest to teach your patients, and it just takes them from like a dependent supine to sitting to an independent. They can easily do this independently, okay? So the first thing I want to do is move her arm over to this side, get this arm kind of out of the way, and you can do a couple of different things. You can wrap one leg over top of this way. If they can bend their knees, that's the best way to do it, okay? And so you're going to roll her to her side, okay? And what I want her to do, even if she's not very strong, I want her to try to push with that arm and dig her elbow in with the arm that's closest to the bed, okay? I'm going to swing her legs off the bed, and at the same time, my hand's gonna be underneath her shoulder in order to sit her up, okay? The legs kind of act like a pendulum. So when you swing them off, it's just one move together, okay? So my hand's underneath her shoulders, and I'm gonna move her legs off and have her sit up, all right? Then from there, I'm gonna transfer her back into this chair, okay? Get it close so you don't have to do a whole lot of work. I'm gonna be up close and personal. My arms are around her, and they're holding the gait belt, okay? So we're gonna rock on 3. 1, 2, 3, and transfer over, okay? And she sits. Okay, I want everybody to practice that. Find somebody that you can do that on. Don't use the biggest person that you can find to start with, okay? But you should. I've transferred patients that are 2 and 250 using this, and it's just using good body mechanics. If you don't have a gait belt at home, grab a sheet and tie a sheet around them and use that as a gait belt. And you don't have to have a wheelchair. Just use a chair that you have at home, one without sides probably to do this type of a lift, and your regular bed. One other thing I want to say, I'm out of breath. Why am I out of breath? If you have a hospital bed, you want to make sure the hospital bed is slightly higher than the chair, so you can use gravity to assist you. If you have, if they're in the wheelchair and they're going to the hospital bed, lower the hospital bed so that it's at least level. If it's level, that's good. Or if it can be lower than the wheelchair, it's even better. It's going to assist you in doing that.